This is KTVO's Good Morning Heartland.
And welcome back. Most people who experience cardiac arrest at home, work, or in a public location end up dying because they don't receive immediate CPR from someone on the scene. As a bystander, don't be afraid. Your actions can actually help. So this morning we have Troy Mihaljevic with us this morning to talk about more about the proper procedure of doing CPR on somebody. How are you doing?
I'm good. Thanks, Ella. Good morning.
Good morning.
Morning, Brian.
Morning. All right.
Thanks for having me.
So from what I understand, it actually has changed, right? The way you would perform CPR on somebody, since you no longer...
It's changed a little bit for the layperson,
okay,
the general public, in a sense that a lot of people were very hesitant to do CPR on someone because they didn't want to do mouth-to-mouth resuscitation or ventilations. And so they've taken that piece away, and they teach a program called hands-only CPR.
Okay.
The emphasis on CPR is on compressions now. If we can just, compress the heart and pump that blood and get it circulating throughout the body, their chances of survival are going to be much better. Although healthcare providers were, still asked to provide ventilations and all the same thing that we used to do for several years. It's just with the layperson, they've sort of changed their approach a little bit.
Okay. So you brought a dummy here that you actually use for training purposes, right?
Right.
All right. And so we're actually going to have, you're going to show Brian how to do this.
Okay. Very well.
Bring this a little closer.
Brian, first of all, if you come upon a victim of cardiac arrest, the first thing you're going to want to do is get him off of the table and onto a hard surface. I mean, I know we're doing this for demonstration purposes. Get him onto the floor and do a very quick assessment, kind of scan the individual, determine that they're unresponsive, they're not breathing. If you know how to check a pulse, go ahead and check a pulse. If not, if they don't look like they have a pulse, they probably don't have a pulse. So the idea is, in today's world, to go ahead and initiate compressions.
Okay.
So we'll say you've done that assessment and you've determined this person is in fact unresponsive and they do not have a pulse, and so compressions are needed. So
so what do we do?
What would you do? You haven't, I don't know if you're CPR certified.
I am not. I mean, I would just start compressions over the heart area, but how do you need to have your hands, and what position should I have their body?
Well, your body position is very important, your body mechanics. CPR gets somewhat tiresome. And in a lot of cases, the bystander is doing CPR for up to 10 to 15 minutes before the ambulance gets there, depending on where the event occurs. But you want to interlock your hands. A lot of people like their dominant hand down, non-dominant. It doesn't really matter. You're going to want to bare the chest because you're going to need to locate the sternum, which is the breastbone, and then you're going to put your hand basically in the middle of the sternum, interlock your fingers, and it's kind of hard on the table, but you need to get in a point where your elbows are straight and locked, and your shoulders are directly over your hands, and you just compress in an anterior-posterior fashion.
Just on and push down like that?
Yeah, and you want to compress to a depth of 2 inches for an adult.
Okay.
Or one thing that is a little bit easier to remember, because the depth changes for an adult and a child and an infant, is always compress about 1/3 the depth of the chest wall. Okay. So however deep the chest wall is, you want to compress about 1/3 of that depth.
Right, and I know a lot of people might be afraid of breaking the ribs. Is that a real possibility, or can you not do it hard enough, or should you not worry about that? It's more important to get
the faster and the harder the compressions, the better.
Okay.
You may break ribs. Unfortunately, that's a potential side effect of CPR. But this person is in very dire straits, and if you successfully resuscitate somebody, then the fact that you may have broken a few ribs is going to be something that, they'll heal.
Exactly.
So, yeah.
Okay. And really quickly, let's touch base on an AED. So when would you use this?
Well, with a victim of sudden cardiac arrest.
Okay.
So you've initiated CPR, and as you guys know, in a lot of public buildings in the Kirksville area, we've placed AEDs. We've actually just placed our 60th AED.
That's great.
And just kind of all over the town and all over the community. And the earlier these are used, the better. The statistics show that for every minute that goes by for a victim of sudden cardiac arrest that is not defibrillated, their chance of survival reduces by 10%.
Wow.
So you can imagine after 5 minutes, they have about a 50% chance of survival and so on.
And for somebody that isn't familiar with this, this actually does a step-by-step and it walks you through it, correct?
Yeah, you can go ahead and turn it on and it'll walk us through. I don't know how much time we have, but if we have time to take us a couple minutes to get through it.
Okay.
Apply pads to patient's bare chest.
Oh, so it is literally a step-by-step, because
I see
take these off?
Yeah, peel them off and put them right where the picture shows. And these have lost a little bit of adhesive because they're
So
a
you
training
put them
model.
like right over the chest area?
Well, just where the picture shows you right there.
Plug-in connector.
So basically, yeah, that, and then.
Oh,
right
okay.
there.
Just kidding. I
That's
cannot
okay.
read
That's
pictures.
okay. And then you're going to plug this adapter into the machine next to the flashing light.
Apply pads. Plug-in connector.
And then.
And
Analyzing heart rhythm.
now it's reading the heart.
not
It's
touch
sensing
the
what the heart is doing.
Press
And if it's in
pads
two very
firmly to
distinct
patient's
rhythms,
bare
it's going to
chest.
deliver a shock.
Okay. And how long does this usually take?
It should be very quick here. It's going to tell you whether a shock is advised or not.
Analyzing heart rhythm. Do not touch the patient.
I'm not going to touch it.
And that's real nice because I see these all over the place, but
Shock advised.
no idea how to use it.
Not to interrupt, but so it's sensed that it's a shockable rhythm.
Of patient.
It's telling you that you need to shock your patient.
Deliver shock now.
You're going to need to push that button to deliver the shock. One thing you want to do is make sure no one's touching the victim
Right.
before you do that.
Okay.
And so you just want to say clear, everybody clear, and then push the button.
Deliver shock.
Do you want me to push it?
Yeah.
Press the orange button. Shock delivered.
Okay, so this is obviously a mannequin.
So it's not going
In
to-
real life, the person is going to, there's going to be some contraction that occurs, and
Right.
but the hope is, and the idea is that you are able to defibrillate a heart and return it to a normal sinus rhythm, and hopefully regain perfusion, and the person, survive this event. That's the idea.
Now,
So-
is this a one-time deal and then you resume compressions, or will you maybe need to do this twice?
Well, it depends on the outcome. If it's successful and it restores the normal rhythm of the heart, then they're going to be pushing you off their chest
Okay.
more than likely. If they're not, then go back to compressions. And every 2 minutes, this device is going to tell you to stand clear, reanalyzing,
Gotcha.
and determine whether a shock is needed or not.
All
So,
right. Well, thank you so much. We've
You're
learned
welcome.
so much, and we'll
We
post
have.
all of this on our website at heartlandconnection.com. We'll be right back.